Studiare vuol dire conoscere e anche incontrare. Ti aspettiamo in un luogo ricco di opportunità per la tua crescita professionale e personale. Università Cattolica del Sacro Cuore.
Più investiamo nel presente, prima raggiungiamo il futuro. Questa è l'idea che ci spinge ogni giorno a muovere il nostro paese verso la ripresa, a dare a tutti nuovi percorsi da seguire, a usare l'innovazione per essere più liberi di crescere, a esportare la nostra eccellenza italiana nel mondo, ad anticipare i cambiamenti per costruire un domani più sostenibile con tutti voi. Perché il futuro è la nostra destinazione, solo se è un viaggio che facciamo insieme.
Studiare vuol dire conoscere e anche incontrare. Ti aspettiamo in un luogo ricco di opportunità per la tua crescita professionale e personale. Università Cattolica del Sacro Cuore.
Più investiamo nel presente, prima raggiungiamo il futuro. Questa è l'idea che ci spinge ogni giorno a muovere il nostro paese verso la ripresa, a dare a tutti nuovi percorsi da seguire, a usare l'innovazione per essere più liberi di crescere, a esportare la nostra eccellenza italiana nel mondo, ad anticipare i cambiamenti per costruire un domani più sostenibile con tutti voi. Perché il futuro è la nostra destinazione, solo se è un viaggio che facciamo insieme.
Bene, benvenuti a tutti.
Good afternoon, welcome everybody in Rimini, and I would like to thank all our guest speakers connected online. And here with me, we're going to have our session, the central role of scientific research, the challenge of a vaccine and effective therapy. Here with me in presence, we have the Undersecretary for Health, Mr. Andrea Costa, and then online, connected with us, there are Stefano Bertuzzi, CEO of the American Society of Microbiology, Skhumbuzo Ngozwana, CEO and President of Biovac and Kiara Health, Professor Walter Ricciardi, President of the World Federation of Public Health Associations and full professor of Gene and Preventive Medicine at the Catholic University in Rome. Thank you all for being with us. What is the main topic of today's session? In today's session, we would like to address the impact of scientific research, as highlighted in the title, has had and will have on our life. The fact that we are here is evidence that the topic is really important. Last year I was at the meeting in a sort of TV studio. Today we have some audience. There is people in front of us. So there's been some change, and the fact that we are here on site in presence is tangible evidence of the impact of scientific research that it has had and will have on our life. We still remember the welcome address by our President Mattarella. He wished us for the meeting to be a point of restart, a place where people can have an encounter, can meet, and that's the basics for restarting. Free people must have the freedom to move in the society and so to restart the society itself. So I would like to recall our President's introduction, and I would like to ask the first question to Professor Bertuzzi. Professor Bertuzzi, in this session, we cover different geographical areas. As we said before, Professor Bertuzzi is CEO of the American Society of Microbiology. He's Italian, but he is based in the US, and his career has been in the US. So he can tell us about the situation in the Anglo-Saxon world. Then we have Mr. Ngozwana, who is from South Africa, and he can tell us about the South African reality with respect to the vaccination rollout. And then Professor Ricciardi is known by many of us, and he will talk about the potential of research and what it means to do that in public health systems such as the one in Italy and in Europe. And then our friend, the Undersecretary, Mr. Costa, will give us the perspective from the other side of the decision-making process based on the scientific research. So, Professor Bertuzzi, the first question is for you. From your point of view and the direct experience you have lived over the last few weeks, what has been and what is today the role of society, or the role of research in society, especially with respect to politics and decision-making processes and also information, as we have seen in these weeks that it has a fundamental role in this pandemic crisis. Professor Bertuzzi, you have the floor. Thank you. Thank you so much, and good afternoon, everyone, all the participants in the meeting, both in person and those connected online. It is really a great pleasure to be here with you. I'm connecting from Washington. It is a gray, rainy, drizzly day, and so I'm sure that the sunshine that you have in Rimini can counterbalance the current environment I have to bear with. What about the relationship between politics and science and scientific research? This is a very good question. I can tell you about my experience in the US, as I have an experience here with the American Society of Microbiology that has been at the forefront since the very beginning in trying to inform and support politics to make decisions with respect to the pandemic, during the pandemic since the very beginning. And then we've had a change of administration during the pandemic, and it's been a very interesting and complex process. I would like to begin with a few data that we have gathered through some associations that we work with. And the first one is a very good piece of news. That is, the vast majority of American citizens in very reliable samples, considering different demographic data, rely on science. They trust a lot science. About 70–80% of American citizens, and not just American citizens, I mean the people living in the United States, have a very positive view of researchers and research. And this is a very positive thing, obviously. However, if we look at this datum in detail, things are more complex than they look like. Unfortunately, part of the population do not really know how science works and do not know about the roles. I give you a series of figures. About a third, more than a third, 35% of American people think that if we didn't have action from by the university-based research or public-funded research, there would be no problem at all. And why is it so? Because there is philanthropic support, or individuals, the private sector may make up for the role of the public in research. And many, actually nearly half of the population, think, almost 50%, think that this is good, and think that if the United States decided not to invest in research anymore, there wouldn't be a problem because other agents would do that. You understand that this is not how research works, because it is true that there is a fundamental element in the relationship between private and public. Base research, academic research, and blue sky research is fundamental. And if we manage to have phenomenal vaccines in less than a year, they're really, really effective in record times and with the very high safety standards. Well, this was possible not just because everything has been done in 10 months, but especially because of the huge investments that we've had in research. So you see that the whole issue is complex, and people do not really know much about it. I would like to mention a couple of more details of how things have changed over the last few months. Since 2019, between 2019 and 2020 in the United States, we could see that there has been an incredible growth in American people's public opinion about how researchers should deal with politics. That is, in 2019, only 30% of the population thought that researchers should collaborate with politicians, whereas the vast majority of Americans thought that researchers should stay away in their ivory tower and not to get their hands dirty with politics. Well, in 1 year, this figure has increased from 33 to 46%, which is a dramatic change in just 1 year. I think this is very positive in a way, because it is sometimes difficult to communicate this, but people has become more aware of this. I see research as two poles of pressure. On the one side, we have curiosity. People should ask questions and look for answers. This is the big value of research. On the other hand, there is also the need for research to respond to public health issues, to meet some priorities in society and in everybody's life. So in my view, the very positive point of these figures is that over the last year, during the pandemic, the vast majority of people, or there was a big increase in these people that realized that for researchers it is very important to interact with politics and inform politics. So I think these are interesting details. There's a lot to do, still a lot to do, but there has been a very interesting change. I don't want to take too much time, so I will just conclude by saying that in the relationship with politics, our relationship with politics is fundamental. If you have more specific questions about how we did that in the United States, in very difficult situations since the very beginning. Well, we had to redraft some acts, some laws, and to overcome big problems, especially in terms of diagnosis. So the measures and the actions that were undertaken have been really, really big and important by all of us, researchers and organizations that represent research, to interact with the government in the decision-making process. At the beginning, especially of the pandemic, I've spent a lot of time in the Situation Room of the White House to report on the situation, what to do, make decisions, and take contacts. So this is very positive, I think, and I believe that more and more American people have realized that now it is important for researchers to interact with politics and politicians. But the last message I would like to mention is that from our analysis, from our studies, I think that we can say that the attitude of researchers sometimes is to open up directly to the public. We've been trained, we've been educated to talk about data and to talk to the brain, and that's how it should be. But when we interact with politics and with society, I believe that it is important to talk to the brain, but we should start from our heart. That is, it is fundamental not just to preach, but to try and have empathy and to feel empathy with people. I think that this kind of attitude is very positive and should be always remembered, especially now that the situation is really dramatic with all these people against vaccines and hesitating before vaccines. I mean, I would like to say, don't you see the data? Science says that it is correct, it is fine, but also the right attitude would be to establish relationships with people and to get to the brain, to the data, starting from our heart. When I talk to skeptic people about this, I always try to find a link in this way. I say, okay, I see that you are skeptical and we have something in common. I am skeptical too as a person. In my entire life, I've been trained to be skeptical, to question myself and to check whether these questions can be confirmed or disconfirmed. So we have something in common. So we can now discuss why some data go in one way rather than another way. So this is a very simple way to move about it, but it is a very interesting approach to understand how to have a relationship with the politics, with society, without raising barriers. Sometimes researchers say, well, this is a very difficult point. I should try to simplify it for you. That this is the very opposite thing than what I said before, because a separation is created. I know, you don't know. Let me preach about a little bit about research. That should not be done. I think it is very important in having a relationship between research and society as much as possible. If researchers are not involved, do not get their hands dirty in the society, these two poles, pressure poles I mentioned before, they need to respond to questions, but also to meet the needs of society and public health. Society could suffer from it a lot. Thank you very much, Professor Bertuzzi. I'm sure that your words got to the core of the issue, to the heart of the problem of our debate. We now move to Africa, and I would like to ask Dr. Ngozwana to tell us about the current situation in Africa, remembering what Pope Francis mentioned 3 days ago, restating the importance of the vaccine and getting vaccinated, and secondly, the fact that vaccines should be accessible to everyone. So we immediately think about the African continent. Dr. Ngozwana, please tell us about your view of the situation in Africa today.
much. I think, first of all, just to express my gratitude to be invited to this very important meeting. As I said, I'll be talking about the situation of COVID in Africa. And just by way of background, the continent of Africa is a continent with 55 countries and 1.3 billion. So I'm going to just give you a little bit of the background around COVID, the current situation as we see it, vaccine coverage, and of course, hopefully propose a few steps that can be taken to ensure that in future we are better prepared. So I think just by way of background, as I said, it's a continent of 55 countries, 1.3 billion. But the reality is when COVID happened, the healthcare systems on the continent were caught completely unprepared. And it was a direct result of a number of factors. One is chronic underfunding over the last couple of decades, which essentially translated into an unreliable supply of essential medicines, an inability to procure PPE, testing services, and eventually vaccines. There was clearly a shortage, of course, of healthcare workers, whether you're talking of laboratory personnel, infectious diseases specialists, epidemiologists, critical care specialists, and all of these things obviously translated into poor outcomes, into poor, basically an impoverished ability to contain the pandemic. The third point is obviously around the poor infrastructure in many countries. So the hospital system is normally centralized. Hospitals are very poor, operating out of a cage, and antiquated equipment. Laboratory systems are lacking. Tracking systems are tracking. And just as an example, and this is a statistic that came from the WHO, at the start of the pandemic, there were less than 6,000 ventilators on the African continent, right? We also know that electricity supply has been an issue. And of course, in dealing with this pandemic, with people going into ICU, needing oxygen and all of that, electricity supply was one of the critical elements that were needed. Why is that? Obviously, again, decades of neglect and underfunding. Things as simple as oxygen, which are needed in hospitals, were found lacking, either because they are old oxygen plants or they are heavily centralized, and to get oxygen from the towns or the cities to rural hospitals and clinics proved to be a challenge. In fact, in some instances, there were insufficient tanks to transport the oxygen, necessitating a situation where tanks were diverted from other sectors of the economy, which obviously then impacted those sectors. One of the challenges that the continent obviously faces and continues to face is when you have informal settlements with overcrowding, people normally sharing, small confined spaces, the usual measures that we talk about that are being promoted, social distancing, self-isolation and quarantine, self-quarantine, become basically impossible in such a situation. And of course, that helped in many instances to fuel new infections. Now, what is the reality, of course, is during the first and the second waves, the number of cases in Africa were very low. Could it have been because of inadequate testing infrastructure, lack of laboratory infrastructure, and low testing rates? One never knows. Where the other issues, I know TB vaccination was mentioned, the sun, and a host of things. But the reality is that almost led to a false sense of security, right? But whatever the case might have been, because of the lockdowns, hard lockdowns that happened, there was significant economic devastation for many national economies. A lot of companies were closed, they retrenched, there were massive job losses, and over 15 million people, according to the latest statistics, have literally been pushed into poverty, reducing the gains of the last 2 or so decades. Now, a tragedy of this pandemic is that because of this hard lockdowns and a heightened focus of healthcare systems on the pandemic, normal conditions, your chronic conditions, cardiovascular conditions, and then of course, cancer, TB, other infectious diseases, HIV, the care for this, medical conditions suffered as a result. And in fact, there's been instances where, breakthroughs or increased numbers of infections of things like TB, or people who are normally controlled now going into some form of resistance. So that has been a tragedy. And of course, we know that what happened when the pandemic hit is global supply chains broke down, leading to a critical supply shortage of critical medicines. There was price hikes and price gouging. And of course, some countries decided to restrict the exportation of certain critical elements. That also had an impact on the African continent. So where are we as we speak today? There are now more than 7 million infections that are recorded across the continent. Just over 6.5 million people have recovered. The death toll currently stands at 190. These are figures from about a day or two ago. It's probably gone up to about 192 or something. Why? Because the fatality rate is quite high. It's around 2.6% versus the global average of around 2.2%. And of course, in the last couple of months, especially the last month or 6 weeks, a number of countries have actually seen increases in mortality of up to 40% in a week. And just to put it in perspective, driven by this Delta variant, we've seen exponential increases in infections to the extent that in 1 month, the jump was literally 1 million new cases compared to earlier when it took about 3 or 4 months to move from 4 million infected people to about 5 million. Of course, there's a sense that there's still some underreporting. Some people die at home. Some people die in hospitals, but maybe their deaths are attributed to something else. Some people are completely underdiagnosed at the time of death. So it's very likely that the numbers are actually much higher. If you look at some countries like my own South Africa, and you look at, you sort of trend the deaths over the last 2 or 3 years, you'll see that there's a significant number of deaths that are unexplained, a huge jump over the corresponding past period. So could that be, COVID-related? One doesn't know. What you don't know for a fact is that our hospitals are overwhelmed. Healthcare workers are close to breakdown. They're fatigued. Shortages of critical products, essential products, PPEs, oxygen, certain medicines, and of course, even ventilators continue to obtain. So with all of this in mind, what's the vaccine coverage like on the continent? Tragically, I think it was said in the beginning that I am also associated with BioVac. It's a local vaccine manufacturer. I chair the board of BioVac. There's limited local production of vaccines. BioVac is one of the few companies that do on the continent. And so a company like BioVac has recently struck a deal with Pfizer that will see BioVac deliver over 100 million doses of the Pfizer vaccine from next year. Johnson & Johnson and Aspen have struck a deal where, the final steps of production, fill and finish of the J&J vaccine will be carried out in the Aspen plant in Port Elizabeth. But of course, tragically, a lot of this are exported overseas. So as things stand, there is not a single African-based manufacturer of the vaccine, although there's some progress towards that. What has Africa done under the COVAX initiative and under the African Vaccine Acquisition Technical Team that was set up by the African Union? The continent has procured about 300 million doses so far, and these numbers are increasing every day. But it's still not enough. We need to probably vaccinate in the region of about 750, 850 million people to get anywhere near herd immunity. And of course, the scourge of substandard and falsified products is already in the background with fake vaccines circulating in some markets. In reality, then what this means is that only 1.85% of the eligible population has been fully vaccinated, which is less than 1.5% of the global numbers. A real tragedy when you know that clearly, if we are not vaccinated on a continent, we might not be safe, but it also means that other people, at least those who travel, would also not be safe as well. So there are still significant access challenges. There are still significant affordability challenges. And of course, the rollout of vaccines is not an easy thing. You need all the allied and accompanying products. You need your syringes, you need your swabs, you need the infrastructure, you need to be able to track and trace, and you need to be able to record the people that have been vaccinated. And all of these things are challenges for many countries on the continent. So how do we mitigate this? How do we make sure that in the future, perhaps as a continent, we are better prepared and that we can handle the current epidemic? Obviously, it's important to observe and enforce stringent non-medical measures, avoidance measures, especially, even within the context of the challenges that the continent has, overcrowding and all of that. We need to be able to kickstart production of, personal protective equipment, the test kits and the PCR kits that are needed to diagnose in time. And that might mean, for example, that, developed countries engage in technology transfer. It might mean that local governments then fund research entities and companies on the ground. We've seen successes in South Africa with testing kits and ventilators and in other parts of the continent. And so of necessity, what this does is to call for international partnerships because, if Africa is left behind, it also has implications for other parts of the world. So why is it critical? We need to be able to produce vaccines locally, also to address the issue of variants, which are obviously going to come. We're talking Delta now, and clearly there are other variants that will come that will need these current vaccines to be tweaked to be able to respond better. And I think one of the things that is also needed is some kind of vaccine solidarity, if one can call it that, to be able to ensure better sharing of the currently available vaccines, because the situation where some countries hoard and some have nothing, I think is unsustainable and doesn't help anyone going to the future. So I think I'll pause there, and if there are any questions now or later, then one can take them. Thank you.
Grazie mille.
Thank you. Thank you very much.
Grazie mille.
Thank you very much, Dr. Ngozwana, because the warning message that you conveyed is very important, because no one lives in an isolated world, because every decision is interconnected. And we saw that, and we will. So what you said is very important. European states, the US, and other industrialized countries should work on technological transfer, because this is the only way for the African region and other developing countries to be able to respond locally to the COVID emergency. Thank you very much again for sharing that with idea. And we all still have in mind the words of Pope Francis. So let's now move to Italy from Africa. So we go back to Europe. So as president of the World Health Federation of the Public Health Association, and also as consultant of the National Health Minister, Mr. Speranza. So in your opinion, and consider this context, and starting from your experience, because we really like to focus on personal experiences in order to let people better understand and investigate topics from that vantage point. According to your own experience, which should be the right balance between the work of the scientific community and the evidence that is generated by that kind of approach? And also, what about the information policy? Well, that is a key aspect, because scientists need to come to compromise with final users, because usually scientists have access to accurate information. And so what do we mean when we say scientific evidence? That means that there are tests, there's proof of what is being stated. So those kind of results represent scientific certainty, especially when scientific certainty is conveyed. In other words, many scientists know that in spite of the scientific dogmas, it is important to face the situation because there are problems that cannot be solved by countries individually. The same applies to climate change and also the migratory flows. There are 180 million people on the run, leaving their countries and trying to escape difficult situations. And then there is a pandemic. And if undecided remarks are made, this pandemic will last much longer. And no country in the world has been following carefully the scientific indications. Even Australia and New Zealand, that are experiencing a lockdown now, in the beginning they followed the advice of jacketing in Australia and bucketing in New Zealand, but then they realized that the mass vaccination campaign was keen, but today vaccination is limited to 20% of the population in terms of progression. So that said, we say that scientific evidence should somehow prove the good grounds of scientific research. And as to Africa, we have extraordinary, effective, and good vaccines. Public Health England yesterday published some data about the effectiveness of the UK vaccination campaign because until yesterday it has fully vaccinated 63% of the population. And again, please listen carefully because I couldn't believe that. So they have somehow avoided 83,000 hospitalizations and 95,000 victims and casualties and another 24 million cases. So all that was avoided. So these figures speak by themselves. And I mean, the vaccine is the only weapon we have to fight against COVID. This is not the only one because we have masks, so we have social distancing measures and other gestures of the same kind. But today we have countries that are fully vaccinated with modest rates and others with very little rate. So if we keep going like that, nothing meaningful will be achieved. So we should consider suspend temporarily the patents in order to favor the ecological transition and a much more intense supply. And 1.2 billion, 1.3 billion vaccine doses have been inoculated so far, and they are all concentrated in industrialized, rich countries. So the presence of the virus will certainly lead to variants that may risk to jeopardize the vaccine. Well, unfortunately, the landline by Professor Ricciardi dropped. Let's try to resume the connection. Let's try to recall Professor Ricciardi. Can you hear me? Yes, yes, now we can. The Delta variant changed things upside down. It's extremely contagious. It's not lethal. So the vital charge compared to Wuhan is incredible. So it's up to 1,000 more. So we should keep vaccinating as quick as possible. Thank you, Professor Ricciardi. So I link up with what the previous speaker said. So Undersecretary Costa, as political representative and being part of the government, you are asked to make decisions, and decisions are made on the basis of scientific evidence. In your opinion, and going back to your experience, I mean, what is, in your opinion, the right balance, and which are the lessons you learned so far? First of all, I would like to thank the organizers for this opportunity, and also a big thank you to the meeting for deciding to organize this important large event also with in-person audience, because we all really need to restart. Over the last 1 year and a half, the pandemic had to face very difficult situations, and this pandemic is also a great opportunity for politics, because it has the opportunity to get back its own responsibility. And politics should consider scientific evidence and should also try to make choices on the basis of scientific data, trying to cope with that and try to cope at the same time with the economic emergency, because when in April we launched this gradual reopening of places and rooms, we try to do that by combining two key elements, and it is important to keep some margin for maneuver. I think about the Green Pass introduction. Many people consider that as a freedom-limiting tool. Instead, it is a tool that guarantees freedom and let us avoid lockdowns. And then there are scientific evidence that should simply be acknowledged and accepted, especially by politicians. I do believe that what Professor Ricciardi said is true when it comes to the usefulness of the vaccine and the fact that it's the only way out of the pandemic. Well, I think that this is a pretty clear and straight message. And in this case, political representatives should try to convey their best performance, and also we need to have policies that do not somehow nurture conflict. Instead, the vaccine is a gesture that helps the community. The vaccine let us avoid having an emergency in hospital wards, because we need our hospitals to go back to normal and go back to their normal activities. We lost too much time when it comes to heart surgery and cancer. So the vaccine is really a tool to make sure that we can really go back to normal and to have functioning hospitals that can really heal people when it comes to other diseases. So citizens are asking politicians to be more consistent. And again, this is not the time of conflicts. On the contrary, we should try to do our best to give our own contribution and try to make the best out of it. When it comes to scientific and research, we talk about men and women that work for the common good and that look for solutions, especially for communities, to face complicated situations like the pandemic. Let's think about our healthcare staff, men and women who decided to devote part of their life, to such a noble activity, trying to heal the sick, trying to cope with such a difficult situation. So I think that really this pandemic, underscored a key aspect, something that should be kept very clearly in mind, because some fights like this one can only be fought all together for the common good, for a greater good. Well, so from this vantage point, pandemic highlighted this. So politicians should do their best to grasp this opportunity, because certainly policies will change after the pandemic, and the political attitude will also change, because we need openness. We need to put back at the very center of the political agenda the human being and individuals. Thank you very much, Undersecretary Costa. I would like to go back to what you said to ask you another question, the same for everybody. The President of our Republic, Mr. Mattarella, this morning mentioned the importance of vaccines, as you said, and he said that he really hopes that this meeting marks a moment of restart in order to, again, restart altogether. But the very same title of the meeting tells us very clearly that, as you all said in different respects, you can't restart without restarting the economy, because if people do decide to not accept the food border, did not accept that, I mean, we will never sort of get rid of this situation. This year's meeting is the courage to say "I," and this is a quotation by Kierkegaard, a Danish philosopher that was studied very often in school by children. So my question is, to what extent this courage to say "I" has pushed you over the last few weeks and months, considering your level of responsibility on an average? How did you change by sort of reacting a certain way to the pandemic? Because Pope Francis said it very clearly, already said it in March last year. He said that the worst danger in this crisis is to waste it and not to make a proper use of that. So I would like to ask Professor Ricciardi as first to somehow respond to this thought-provoking remark. Yes, can you hear me? Oh, yes, definitely. When the pandemic started to somehow broaden up, I got information in a few minutes. The Ministry of Health, Mr. Speranza, and the Prime Minister at the time took some key decisions when it comes to food. And also, it is important to underscore the role of scientific research. And I would also like to say something that links up with our South African colleague. And COVID took 6 months to reach 600 million cases, because the Delta variant is really incredible. So reaching 400 million cases, it's not so far as a total. So this could happen in 3 months' time. That is why we need to somehow relax, but be careful. I'm very much worried by the reopening of schools, because in Scotland they reopened a few days ago, and I mean, contagious levels went up again. So, and very often children are then a vector for the sickness for adults. So it was somehow, unfortunately, strengthening of the situation. So, Mr. Ngozwana, how did you experience these months? Which was your experience?
Yeah, and or whatever 9 months has been very humbling. I think I've learned a couple of very important many lessons, and I think many people have. The first one is, the fragility of life, and the fact that we need to make it count. I mean, whether you are a billionaire or a pauper, European or African, whether you are black or white, conditions like COVID make no distinction. And of course, the speed with which it is caused this devastation, again, re-emphasizes the fragility of life. The second thing is really the interconnectedness and the indivisibility of all of life. The days of saying this is a condition for those people across that sea are over. And I think we've all come to the realization that whether we like it or not, we are in it together. The one thing I think that I've learned, and I think many people as well, is to be more humble. And I'll put it in the context of something that's gripping many countries now around the so-called anti-vaxxers and whatnot. I think our lesson is educate, don't judge, don't ridicule, because you don't know what drives some of these, views that are out there. The fourth thing is obviously that mistakes are inevitable. Nobody's perfect, whether it's politicians or scientists and I think we need to sometimes take a step back and always think that the other person is acting not out of malice, not out of intent to do any harm. They're trying to do their best. So when mistakes happen, we need to be a little bit more understanding. And then I'll close by saying that, I think 3 or 4 times the moderator quoted, Pope Francis. And I just want to go back to another Francis of Assisi, who said, preach the gospel. And if you must pray, use words if necessary. This is the time where we step up outside of our comfort zones, outside of our boundaries and national geographies, and say, we need to go out and reach out to God's other children and help. Nobody's going to escape this thing on their own. We are interconnected, we are in it together. And again, I stress whether we like it or not. So for me, what has really been important is that fragility and that interconnectedness and the realization that to be able to solve this problem and some that are going to come into the future, we need to come together as a world, otherwise we are all in trouble.
Grazie mille, Sottosegretario.
Thank you very much, Undersecretary Costa. What is the lesson you learned? Have been working in this position over the last 5 months, and I've tried every day to be humble and learn things. And I also experienced COVID personally, and it was incredible because for me, it was an opportunity to experience the humanity that goes beyond the skills and the professionalism of our healthcare staff, because they did something incredible. This pandemic showed us that we need many eyes to build up an us. And politicians, I forgot to say it beforehand, cannot, avoid to listen to, the calls for help that come from Africa. And we need to unite forces and try to go beyond our borders, because if we, close ourselves, in our little fortress, well, we won't fix anything. So we need to be more accountable and responsible when it comes to that. And this pandemic also let us rediscover some values, some principles that had been a little bit weakened and that had faded out. So probably we have learned once again to set the right priorities in life. So again, another key starting point to rebuild a new world that we hope could and should be better than the previous one. Professor Bertuzzi, what about you? So you said that you visited many times the Situation Room of the White House. So what is your lesson learned? Well, on a personal note, as you said in the beginning, I must say that I learned a lot. I was born and raised in Piacenza. That was one of the most devastated Italian cities, especially in the beginning. So personally, for me, that was very hard. I lost many dear friends and many loved ones and even some young ones. So it was quite shocking for me. I mean, really, personally, for my family, for my circle of friends. And this is something that made me think a lot also about myself and about what I can do, especially when you have a leadership position. What could you do? What could I do to give my contribution and change the world? Well, scientists are not there to describe the world. Well, yes, also, but our final goal is to change the world. So if we consider our role in this context, when it comes to leadership, I immediately realized that leadership is not a popularity contest. Instead, it is a service providing, challenge. So in the beginning, I asked myself, considering this unprecedented situation and context, what can we do to do our best and put all the resources and people we have contribute? So this is a no-profit organization whose main mission was really to concentrate on the impact. Let's try to understand what we can change, if we can change anything. And so that's what we try to do. It's hard. You make mistakes, and there is always somebody who is not happy with what you did. But this means putting yourself at stake for the common good, for the sake of common good. So to me, this lesson was very strong and impressive personally and professionally in terms of leadership. Thank you. I took some notes and I try to also make myself notes. So again, nobody can get out of this by themselves. As you said, Mr. Ngozwana, so you are so right. And also our guests, said that very clearly, because if we do not help each other, if we do not intervene quickly, we will never get out of that. So we are now at the Delta variant. I don't know how many variants could exist. If we do not intervene and act quickly, we will never get out. So we need to help each other because we are all interdependent and interconnected. And as Professor Bertuzzi said, the leadership of a scientist is key and should be about trying to provide the best possible service, considering that politicians make decisions on scientific basis. Well, if scientists consider the level of service they provide to society, this is the right attitude. So vaccines are very important, and we hope that very soon effective COVID therapies will be designed and finalized, because this is also very important. That's why scientists are so important, and politicians should support scientists and research work for the common good. So having many eyes, many people working together. So I would like to thank our guests and speakers. Thank you very much for joining. And so I would like to invite you straight away to next year's meeting edition in person. We wait for you in person. Well, 1 year ago, nobody, was hoping to have so many people here today. I can see in front of me hundreds of people, so this is the first tangible result of what has been done. So next year we're going to be even more numerous, and we're going to talk about how science and scientists that work for the common good were able to let us overcome once for all COVID. And finally, I want to remind you that the meeting, and we have reached this year the 42nd edition, is financially, self-financed. So this is possible also thanks to the voluntary workers and also to many people supporting it. So please do not hesitate to donate at the special Donate Now stations in order to let the meeting keep existing, because it is important to have such places of encounters, hoping to reach so many more editions. I would like to thank once again our guests, and thank you, and wish you a good evening, and see you next year with an even larger audience, in person, of course. Thank you.
Più investiamo nel presente, prima raggiungiamo il futuro. Questa è l'idea che ci spinge ogni giorno a muovere il nostro paese verso la ripresa, a dare a tutti nuovi percorsi da seguire, a usare l'innovazione per essere più liberi di crescere, a esportare la nostra eccellenza italiana nel mondo, ad anticipare i cambiamenti per costruire un domani più sostenibile con tutti voi. Perché il futuro è la nostra destinazione, solo se è un viaggio che facciamo insieme.
Studiare vuol dire conoscere e anche incontrare. Ti aspettiamo in un luogo ricco di opportunità per la tua crescita professionale e personale. Università Cattolica del Sacro Cuore.
Più investiamo nel presente, prima raggiungiamo il futuro. Questa è l'idea che ci spinge ogni giorno a muovere il nostro paese verso la ripresa, a dare a tutti nuovi percorsi da seguire, a usare l'innovazione per essere più liberi di crescere, a esportare la nostra eccellenza italiana nel mondo, ad anticipare i cambiamenti per costruire un domani più sostenibile con tutti voi. Perché il futuro è la nostra destinazione, solo se è un viaggio che facciamo insieme.
Studiare vuol dire conoscere e anche incontrare. Ti aspettiamo in un luogo ricco di opportunità per la tua crescita professionale e personale. Università Cattolica del Sacro Cuore.